Hello everyone, this is Jonathan Marks from Go to Health Media. This is video 9, the final in our series, How Project 2025 Will Change Healthcare in the United States. Project 2025 is the 920-page conservative agenda set by the Heritage Foundation to be implemented if and when former President Trump wins election in November 2024. You can see the complete list of videos we are producing in this evidence-based series. Our intent is to educate you with facts. The architects of Project 2025 believe in reducing the federal government's role in healthcare, aiming to shift more responsibility to the states and the private sector. While this might sound promising to some, it has serious negative implications for healthcare coverage. In other words, Project 2025 for healthcare is simply a bad idea. In video 2, you can see we have covered the health status of red states versus blue states, and how red states will be hit much harder if Project 2025 is implemented. That's because red states have higher disease rates, lower household income, lower state tax revenues to support health care, and lower Medicaid coverage for low-income households. In video 3, we detailed the rollback of the Affordable Care Act, the ACA, also known as Obamacare. This will reduce health coverage for millions of Americans. In video 4, we noted that the deregulation of private health insurance will also reduce health coverage for millions of Americans, as private insurers are now more free to maximize profits. In video 5, we learned that Medicare and Medicaid, two federal programs that provide benefits for millions of Americans, will also be rolled back. In video 6, we saw how abortion will likely be outlawed nationally, how all pregnancies will be monitored, how gender identity will be minimized, and how the definition of family will be limited to one father, one mother, and children, despite the fact that close to half of all families in the United States today do not meet that traditional definition. In video 7, we know that public health programs at the state level will be reduced. Much of the funding for public health from the federal government will be cut, leaving the states with fewer resources to support health education, vaccinations, and disease surveillance. In video 8, we learned that the already challenged rural health system will be further challenged, with reduced federal funding and reduced coverage from both Medicare and Medicaid. We just have to say again, from all the research we've done, Project 2025 for healthcare is simply a bad idea. Because healthcare is provided to us by medical professionals and support staff, we wanted to include in this last video the effect Project 2025 will have on these first responders as they deliver the best services they can under the new conditions of Project 2025. Project 2025 is likely to bring substantial changes to the healthcare system, affecting healthcare workers and physicians through reduced funding, increased administrative burdens, and greater regulatory challenges. Here are a few examples. Abortion care. As we have already seen with the overturning of Roe v. Wade, there are restrictions on abortion services. Healthcare providers offering abortion services face more stringent regulations and increased legal challenges, leading to higher operational costs and potential legal risks. Planned Parenthood and similar organizations will lose funding, affecting healthcare workers employed by these organizations. This will result in job losses and reduced access to reproductive health services for patients. Professional education and training. Professional education and training will also be negatively impacted. Cuts to federal healthcare spending will trickle down to funding for medical education and residency programs. This will limit opportunities for new healthcare workers and physicians to receive training, exacerbating existing shortages in certain medical specialties and regions. If healthcare shifts more towards state control in the private sector, training programs might need to adapt to new models of care, which could involve a greater emphasis on cost efficiency and navigating a more complex insurance landscape. professional job satisfaction and burnout. If fewer people have insurance coverage, they will delay seeking care until they are seriously ill, increasing the complexity and urgency of cases that healthcare workers handle. This can lead to higher stress levels and increased burnout among our first responders. Uncertain funding and regulatory environments can create job insecurity among healthcare workers, contributing to professional dissatisfaction and increased turnover rates. In conclusion, Project 2025 will bring substantial changes to the healthcare system, affecting healthcare workers and physicians through reduced funding, increased administrative burdens, and greater regulatory challenges. These changes will lead to increased job insecurity, higher stress levels, and greater difficulties in providing care. Healthcare providers will need to navigate a more complex and potentially less stable environment, which could impact the overall quality of care and the well-being of healthcare professionals. We'll say it once more. Project 2025 for healthcare is simply a bad idea. Thank you for watching. We hope this video gives insight into how Project 2025 will change healthcare in the United States. Please like this video so more people see it. Thank you in advance. And please subscribe to our YouTube channel so you can benefit from all the videos in this series. This has been Jonathan Marks with Go to Health Media.